Yeah. All right. I am so excited that you took the time out today. So, just a little bit of housekeeping. Normally, what we do, like before when we had our intro call, it's just a conversation. What I will do during the conversation is I will start off by talking a little bit about just real short, like a one or two sentence about Medicaid and Medicare and what's going on. And then I will ask you to introduce yourself, and throughout the interview, which will be anywhere between 50 minutes to an hour, what I will do is I will do like, okay, let's talk about this. And then that's how we shift the conversation. So I'll do that to kind of open the conversation. And then I'll say, well, let's move it on. Let's talk about this topic. And then I'll say what the topic is. You and I have a conversation. And then I will usually conclude by saying, like, thank you so much. I want to move into this topic. What's going on? So that's how we end up getting the segments throughout the hour. Okay.
Understood. Very good.
Sounds good.
Yes.
Okay. Let's
Absolutely.
get started. Hi, everyone. Welcome to All Americanish. I'm your host, Towan Isom. I am super excited to have an amazing guest with me today, Josh, who's now a personal friend because I'm referring to him by his first name. One of the things that we want to talk about today is the continue the conversation on Medicaid and Medicare and what's happening with the big, beautiful bill. As you know, at All American-ish, we don't pick sides, but most people are either one way or the other. But I find that the majority of America kind of is somewhere in between. They kind of are sometimes liberal on some topics and conservative on others. Well, today we want to get really deep into what it's looking like on the streets with Medicaid and Medicare. And so, Josh Klein, who is a new friend to the show, is going to talk to us and help us navigate a little bit about what he's seeing and what we can be doing to bring some change. Welcome, Josh. How are you today?
Amazing. Good morning. Thanks for having me. I appreciate it very much. And I do consider you a friend, just your demeanor and the way you introduce everything and the way you care of this topic. And I very much look forward discussing with you, and perhaps together we can come up with good ideas.
Oh, well, awesome. So tell us a little bit about yourself. I detect an accent. Are you giving me New York somewhere?
Close. Brooklyn. Absolutely.
Brooklyn, get out of here.
Yes.
Oh, it's
Brooklyn,
my
born and
favorite
raised.
place.
Yes, that's a wonderful melting pot. And that is part of what shaped how we care for people around us, is caring for everyone. It gives you an opportunity. Brooklyn gives you that healthy opportunity to see different cultures and understanding that everyone is different in their own way and unique and have so much to offer.
Yeah, why would anyone try to stop that?
I don't know. That's a good question. Something, if it ain't broke, don't fix. I agree.
That's right. So tell us a little bit about yourself.
So I've been blessed to be raised in a healthcare household. My parents were both in healthcare. I grew up in a home in Brooklyn where my mom had nurses that she gave jobs to nursing homes, hospitals, and our living room was her office. Our kitchen was her office. Growing up in an Orthodox Jewish neighborhood, understanding that nurses come from different backgrounds and they used to walk into our home. My mom used to cook dinner. Part of the dinner plan was who's coming for dinner for the nurses that she helped employ. So I was blessed to see some very unique, good upbringing. And I saw how nurses are cared for, people that care for others, how you should care for. And my father as well was an administrator in a nursing home. And
Wow.
that's what formulated my opportunity. My mom gave me my first opportunity to do home health care in the state of New York. And we are blessed to be one of the largest employers in the state for home health care in different verticals. Still, every day, it's like my mom is standing on top of me, making sure don't veer off course what the family mission is. And we
Wow.
grew into multiple states, providing home health care and additional services that are innovative, different, um, centered around patient care and social determinants of health. And we have lots to discuss around that. And
Wow.
looking
So
forward.
So let's get straight into it then. Home health care is a real issue within this country. I have several friends, actually, three in particular, who one has a mother in law that lives with her. She has dementia. And so she has one full time care. They are both successful, so they can afford to have an in home stay with them, and then pay through them. They pay for them through their business. She does other things as well. But they have gone through literally 8 people for home health care aides. And they finally were able to find someone that it really works for them. I have another friend whose mom is a retired teacher, and she gets services, I think, through Medicare, but she's talked about some of the challenges they've actually had with trying to find someone to through the state, because people are getting older. And my friend, who had a great job at the time working for Salesforce, was since reduced because she just had to take care of her mom. She was the only person in the family doing it. And then I have another friend, colleague, who owns an in-home care program, and she's expanded as well her business. What is going on that is so many, like, they all have different walks of life, right?
Yes.
One is really successful. They have their own business. One is someone who has a good net worth income, and her mom had a good sense of retirement, but they've each been through so many people. And they talk about some of the challenges they're having when it comes to the states and trying to get resources and navigate the whole process with Medicare. So just talk a little bit about why we're seeing like that become an issue now with is it people are living older, and it's just so much going on now in that area.
So you brought up a couple of very great areas of conversation. First and foremost, you mentioned dementia. Your friend that has a family member that has dementia. We've recently become what is called in the federal program a guide provider that assists patients with their family, they assist their family in caregiving. The federal government realized that people that deal with parents that have dementia, that it is excruciating and hard and very, very difficult to manage. You can have resources, financial resources, to pay perhaps a caregiver, but to understand how to deal with certain scenarios is extremely difficult. I've personally by way of background, I'm in the field a lot. And when I say I'm in the field a lot, I volunteer as a paramedic. So I get to firsthand see emergencies, and I'm in homes every day. I average approximately 500 emergency calls a year. And the majority of these are either elderly that are not well or young kids with, issues or problems. And when you see how much people that even they have resources and money, they struggle with dementia, caring with dementia, or how to deal with an issue. Family matters within people that have dementia. It is one of the hardest things to manage. If you want to give your parent that has dementia a haircut, sometimes it takes 3-4 people to hold, sadly, the person down just to get a simple haircut. So there are care navigators that help them through the process. The guide program is successful in assisting the caregiver to help them. So there are programs that are getting there to help these people. It's not just always the money. It always boils down to the Benjamins. It does sometimes, but just the knowledge of how to deal with certain comorbidities is very difficult. So that's one. And regarding what you mentioned as far as people that have to stop their job, there are tens and thousands of people that are unpaid caregivers, which means that they have to stop their job because they cannot leave their loved one at home. There are entities, this is not throwing a promotion, but there are entities, non-for-profits such as Archangels that really help people navigate where you can get resources when you want to be a family caregiver. That is becoming a very, very broad an accepted way of delivering care, where family programs where you can hire your family to use as a caregiver. In New York, there's a lot of talk about that. There were a lot of changes in the state, the way they administered family care programs. We provide those type of services in multiple states: New York, Connecticut, St. Louis, Missouri. And in each of those states, they're quite unique because cultures are different. So the people that actually want to go through the process where Medicaid in multiple states, sorry.
That's okay.
Let me just, that's where the lights, I apologize.
Oh, you're doing so good. So this is something that I have seen happen a lot when it comes to where to go, the resources. It can be a challenge because a lot of people don't know where to start. Can you pick that back up, Josh?
Yes. So most of the times there are resources in certain states. Medicaid pays for certain programs, but if they're not aware where to get that information, it's a non-starter. And sadly, the people that need it most don't have access to the information. They either don't go, for example, to the doctor's offices where they might find a pamphlet and pick it up, or they don't have the doctor that they have a longer conversation to speak about what are the resources out there that can help them. And that is, it's incumbent on companies like ourselves that if the government gave us an opportunity to deliver those services, don't follow the money, follow the people that need it. Figure out where are the areas. For example, take New York. Go to areas that are underserved. Go to them. That's where you can make the most impact. Just by mere giving them that resources and that information makes a world of a difference. And I think when you're mission driven, you find those spots. St. Louis, Missouri is a perfect example. There are a big population there, underserved, rural areas. Use your dollars to reach the people that need it most, and it will come. You'll be able to deliver a best service for the people, and you can make the biggest change for these people.
Yeah. And you were saying about the cultural issues that can happen, and I could see that happening depending on where, if someone is of South Asian descent, of Native American descent. I mean, it would make an impact on how they care for the person and for the elderly or just disabled. So I could see it making more sense for them to want to actually have a family member do that than have some outside stranger. That can probably be a little bit inclusive as well, I would imagine.
So it's a double-edged sword sometimes. One of the best things about having a caregiver, retention and caregiving in general, is knowing the patient's little nuances. That means if you have somebody that comes in, if it's a family member, they know their own mom, they know their aunt, whoever they know their baseline because they know them for a very long period of time. So they can pick up, without being a physician or a nurse, they can pick up little telltale sign, something's off. When somebody just comes in for a short while, they don't see the progression of something getting worse, better, or indifferent. And that's why we put in so much money into retention in either the family as a caregiver or somebody that's hired from start, is what can we do? What power do we have? What tools do we have that it should be, like you mentioned, some have them 8 and they swap them out like socks. And every 2 weeks, it's somebody learning something new about this patient. They're not going to pick up the telltale signs. So sometimes the family dynamic is super great. They're very, very, very good because they know the patient and they can alert a nurse, a doctor. My mom is not the same. Things are very off. But yet on the other side, sometimes family, they pick and choose because they can go. So it has its benefits and it has its things. And you have to try to do both well.
How often how many patients does one, let's say, practitioner, or I guess this would be a nurse practitioner working it with the seniors, or because I think we assume also that everyone who needs this type of care are older people. Correct. What are you seeing as it relates to dementia, not necessarily, or just the whole culture shift in younger people, other kind of determinants contributing to this issue?
Right. So a lot of people, just the elderly in general, are coming in droves that need this in general. A lot.
Really?
A lot.
Okay, so a lot of, why now as opposed to before?
Baby boomers is one. That's just the easy thing to say, right?
Okay.
That's just a simple answer. But I think as much as the people are not getting the information, what resources there are, technology age, information is out there that there is help. So the more people that are aware of home care, the more the need comes, because people, oh, I can get home care. And and private enterprise generate business, so they will do enormous amount of marketing on their home healthcare companies. Insurance companies in general will pay everything in their power to make sure that a patient doesn't end up in a hospital. So you're talking payers that will do anything to make sure that they're covered as much as possible. Home care is cheaper than nursing homes. Nursing homes are cheaper than hospitals. So the more information everybody gives out there to obtain those patients, the more people have access. So more people are coming into the system just from an information standpoint.
Okay, so it is mostly baby boomers. Where
Yes.
How long does a home care person work with a baby boomer? Is it like all day or part-time? How does that work?
So depending on what type of coverage you have.
Oh, okay.
Medicaid in certain states more generous. Certain states have more generous, and the way you started the political lines, and it's sometimes the lines are not blurred. Certain states.
Oh, really? I know that with the Democrats, they typically do well. When I did research, we had a show on teaching. The areas that had Democratic governors, the teachers made more than some of the red states. Is that you seeing that as well? Like with home hair, that's not political. That's just facts. So are you seeing that more with home health care as well?
Yes, absolutely.
Okay.
Absolutely. It's an approach because the Democratic Party in general is very in tuned with underserved. That's not to say the others poor people. So automatically there is the continuum of the party is in general very pro giving more. That's not to say we operate in Republican states such as Missouri and have great programs.
Oh, really? Oh,
yes,
wow, that's awesome.
Yes, they do. I guess they learned.
Right, that's true. And then nowadays, people are kind of, they're conservative on some things, but not their health care, not their Social Security, not, so I think they pick and choose some of the things. Right, that's exactly what it is. So what are you seeing are some of the contributors to some of the non-baby boomer home healthcare aids? What causes that?
I didn't understand the question. I apologize.
No, that's okay. So let's say for Gen X and millennials, under what circumstances would they require home healthcare aid?
So there are lots. First and foremost, you have a big pediatric population that needs help.
Interesting.
Moms can't go. A lot of these kids sadly don't go to regular schools. Moms, they go to these specialty schools. Sick kids in general, their family life is a mess sometimes, and they need additional support and help. So the pediatric population is a very, very is a huge need that needs home healthcare services, etc. And then you have, sadly, what we're seeing in certain underserved communities, diabetics that are in their 50s.
What?
Oh, absolutely.
Oh, wow.
Yes. And it's sadly in areas that when we have offices in specific areas where, it's underserved communities, and you walk into the bodegas, the fridges are stacked with the most sugary drinks that you can ever see in your life. I don't know that Yoo-hoo chocolate has 70 different types. I had no idea Arizona iced tea has 50 types.
Oh my God.
And
It's a ton of them. It's a ton of them. I don't. My children don't eat sugar. I don't do sugar with
good
them
for them.
because they get natural sugar through apples. But we don't do cupcakes. We don't do cakes. We don't do lollipops. We don't do candy. We don't do pies. Like
No cupcakes.
no
Here and
cupcakes.
there a cupcake.
No. Only on special occasions. Like when
Birthdays
they
or
cook.
occasions.
Right. Special occasions. Just because I just I grew up in the inner city and extreme poverty. So I know what that looks like with the hot sausages, the Jolly Ranchers that you put in your pickles. Like I know what all that stuff looks like. So
Yes.
and I know it's the slippery slope because at first
Yes.
it's the cupcakes and then it's something else. So I try now I could do better with the vegetables, which I'm working on that. But yeah, you pick your battles.
Yes.
So you
Absolutely.
have a huge diabetes at for people in their 50s.
Absolutely.
Oh
Absolutely,
goodness.
with a
Okay.
lot of issues. And I think it also goes back to education and talk about
Mhm.
poverty. Some of them, even if they knew that sugary stuff aren't good, they can't
They
afford
still
they can't afford good food.
correct. Correct.
They ain't going to a Trader Joe's anytime soon.
No, because Trader Joe's are not being put in those areas.
Exactly. So,
They're not
so you
putting.
have
Yep.
they need it most. They can't afford it, even if they can afford it. It's sometimes sadly a catch 22, and sometimes you're watching this crumble, and you feel what else can we do? So as an entity, as what we
Mhm.
try is as sorry again. Wow.
No, that's okay.
Yeah.
Wow. And I will say this and attest to this. I think that the taste for a lot of people of color, it has to taste good. If it's not tasting good, then I don't want to eat it. So trying to figure out how to make it taste good. But you can, there's so many vegan options. So you're in the bodega, you're seeing all of this crazy food that people are eating, and you're like, the diabetes is going crazy, and you have to attend to these people because the next phase of what some people may know and other people may not know is that there's a lot of amputees as a
Sure.
result to diabetes.
Yes. It is the number one killer. Unfortunately.
What?
Have you ever seen there was this that gentleman, I forgot who the speaker was on TED Talk, and he walks up on stage and he pulls out a cigarette in front of everyone and he's ready to light it. And the whole audience goes, and he's like, what?
I
Cigarette
gotta
is a
find it.
problem? And he takes it out and he's like, diabetes is a lot worse, kills a lot more people. So we sometimes
What?
don't realize we are what we eat.
Yeah.
And
True.
sugary stuff. And these are people that would love to eat healthier. It brings you down and all that stuff. Fast food, that's causing a lot of these issues. And it's just a cultural thing in some areas. And for the most part, it's just not having access to the right, either financially or information wise.
And what about the kids? The pediatric issues is that like mental disabilities or physical disability, cancer? What is that related to?
Both.
Oh.
Both. A lot of kids with genetic issues,
Mhm.
problems. People, kids that were born with, comorbidities, issues, heart defects. So many, so many that need help. Parents just, they need a life, and they need a lot of help. And I've personally seen so many families just are a mess because they care. And you see 12-year-old kids that their sister is not well. Their whole life is surrounded that kid that's not well. So there's so many
Yeah.
snowball effects, and they need lots of assistance and help.
So we set the stage of why people need in-home care support. Are these people LPNs? Like, how do you become an in-home care assistant? What are they called? You know,
Home health aides,
home
uh,
health, home health aide.
personal care aides.
Okay.
But in the continuum, and it's rapidly expanding of the
Mhm.
scope of what home care is. Home care was a very traditional model that for years stayed the same program. Medicare had its program. You left the hospital, you had surgery. Medicare, there was an assessment made, a safe discharge from a hospital. If you had hip surgery, for example, you got a physical therapist that came to your home. You got a nurse that made an assessment, for example, that your wound was okay. And then you got a home health aide to assist you with daily activities that you might need post-surgery. And then there is, if you had Medicaid, Medicaid is the entity that for the underserved gave more for patients at home. They did a lot better for them. But what's happening is payers, government are becoming smarter with their dollars, and they're like, I'm willing to pay lots of money, but show me value. Show me that whatever you're doing is bringing a good ROI. If we're spending money on in-home care, show me that you're not just sending in a person that's just doing their laundry. Show me that's in the daily thing. Same goes with nurses. So a lot of entities such as ours are looking for innovative ways of being in the home, picking up telltale signs, adding nurses that are watching them, remote patient monitoring and management, picking up early signs of sepsis, pneumonia, hypertension. So because payers are starting to look at value, entities are bringing in more services into the home in order to intervene and have an opportunity to keep the patients out of the hospital and in the home longer. That's where ultimately patients want to be. People want to stay home.
So let's shift here and let's talk about how do home. So you don't need a degree or be licensed to be a home healthcare aide.
There is, in certain states, there are different levels of entry into the program. The first license you need, you can obtain.
You cannot?
No, you need to care.
Oh.
If you do not have that as a human being, and what we see is the majority of the home health aid workforce are women. There's a reason for that, because they're by nature nurturing, and the people that we've seen, we try to pick those, is first and foremost, why do you pick home health care? You could have picked a different job. Home health aides, in my mind, have the hardest job in the healthcare continuum.
Oh, God, yes.
It is, they don't get to be like a nurse or a nurse practitioner or a physician that sees the doctor for 30 minutes is a lot. But even if a nurse that comes in assessment, she leaves. She's not there for the kvetching. She's not there for the oh my gosh, this hurts and that hurts. A home health aide is in the home, whatever the hours that they're there for. An elderly person is not easy to care for. Depression, family issues. And what ordinarily happens is the caregiver becomes their social worker, their friend. At least that's what we want. And that is not easy.
So you don't have to get certified or go through any training?
So there is that. So I would say that was the number one. That's the baseline that's number one. But in most states, there are certifications. It's usually not for a home health aide. It's approximately a 2-week program teaching certain actions, such as for patients that need to be lifted, to use a Hoyer lift, how to use it, bed transfers, personal stuff for patients. But what we do, and smart companies that want to do the right thing and have mission and they want to do the right thing, teach their caregivers as much as possible. Let them have the information. And the most important, what we want is, we're not asking you to become a physician, is use your eyes, what are you seeing, what's different, and most importantly, to communicate. What do you see? What do you pick up in the morning? Did you realize, for example, a home health aide doesn't have to be a physician to realize that the patient's legs swelled up. Swelling in the legs is an indicator that something's very, very wrong. Reporting these things make the biggest difference in the world, because if you report it on time, you avoided the patient from going to the hospital, schlepping them into an environment that they might get something, another disease in a hospital that was unnecessary. So these are the things that the more you teach them, and everybody wants to feel, that their job is bringing back value, not just caring. So home health aides now, when I grew up, I mean, I call myself I'll never grow up. I think growing up is a trap. But everybody wants to feel empowered what they're doing. So a woman that cares for a patient, what they bring to the table matters. And if you give them that sense that it matters, and you give them the platform to communicate that, the amount of information is absolutely invaluable. It's amazing.
And so the ones that administer medicine, what's the next level?
So, in our continuum, the way we have physicians that oversee their total plan of care, nurses and nurse practitioners intervene when needed, either remotely or sending down a patient that needs something physically done, changing a catheter, making sure certain medications, pre-pouring medications. A lot of medication mismanagement leads to hospitalizations. So the more the medication is managed, nurses come in and do the pre-pour meds, help the home health aide understand how important the timing is, making sure they don't miss it. So there's a pyramid of what goes on in the patient's home, and if done right, you have from the not so sick that can be prevented and done interventions in order to keep them out of the hospital, to the very, very, very sick that you can bring all type of interventions into the home to make sure that they never end up in an emergency room.
Okay. And how about so the KPIs or the payee, whoever's paying, let's say the insurance company or the state, when you say create value, how do you create value as a home healthcare company?
So the onus is on us to prove that when there was a change in the home, it was your action. It's not so much proving, but if you build programs around showing that a caregiver or a nurse did an intervention. For example, if we put in devices into homes that monitor blood pressure, monitor their blood sugar level. Sorry, here we go again.
That's okay. That monitor, so you can create interactive ways or way of observations electronically or through to see how to monitor the patient, so you don't necessarily have to be there. Okay.
Correct. And that's what we've accomplished the last couple of years is understanding their baseline, putting in certain tools that pick up. For a diabetic, we check their sugar, and pending how often that's needed, there's a care plan around that. And this information is only as good as the intervention that you have. So if you don't have the KPI that you have, if you're just collecting data for the sake of collecting data, it means nothing. Okay, so you collected that information. What do you do about it? That means if you realize that this patient, for example, their blood sugar level kept on going up, what do? Did you change their med? You are the one that changed their med. You made that change. You prevented that actual action of getting progressively worse. So if there are things, for example, if we're monitoring their O2 sat and we realize that they're on home oxygen, maybe the equipment is faulty. And we've had those examples plenty of times where our nurse got alerts where their O2 sat kept on dropping. And we're like, oh, is this something wrong with the patient? Are they developing some kind of pneumonia or whatever type of thing that's might be? We ended up sending a simple tech, and the tubing for their oxygen was kinked.
On average, how many, if you could say, just give me a rough estimate numbers, how many people, let's say 3 years ago, were needing home health care versus what you're seeing now? And was there any impact with COVID as well in what you're seeing?
COVID did lots of things. COVID,
Really?
COVID did. We're very proud of what we've accomplished with COVID. Necessity is the mother of all invention,
That's
and
true.
COVID. Oh, did that create a necessity? And
Yeah.
we grew as an entity from COVID, and was super proud of what we did with, life happens, but what you do with it, and what you do with scenarios. Um, when COVID blew up, I found myself uh, family. Um, my volunteering as a paramedic in the community, a community that needed the first line of defense were actually us. People started
Mhm.
having issues with breathing, and they called the ambulance. And we came in, I remember in COVID times, the first couple of days, we were trying to figure out, as a paramedic isn't a physician, but what do we have in front of us? Are the issues breathing? And we were almost guessing as to how to help them. So we got some very, very good insight. I personally got some very good insight when COVID hit, is I actually saw people deteriorating in no time, and they're getting progressively worse.
What?
Um, stories I can tell you from COVID, a whole different episode on COVID. How many people died in my hands in the middle of me trying to intubate them, and
Ah,
there was nothing to do. Yeah, uh, I didn't sleep much for 6 months when COVID hit. But what it did give me is some insight. Is I had a responsibility of tens of thousands of patients that are
mm.
my responsibility, tens of thousands of caregivers that are my responsibility. The buck
Oh,
stops at at where it stops, and we had thousands of patients that were unattended to. You had you had elderly that were either living alone, families were boxing themselves into homes.
oh,
Patients didn't want caregivers to come in and give them COVID. um, Caregivers
yeah.
didn't go in. So we had to, like, okay, this is the
What do we
issue.
do?
What do you do? What do
Oh,
you do? So lots of entities just, and sadly they just ducked for cover, went under the blanket, like, I don't
where
know
are
what to do. Where are and no judgment, you
they?
know.
Right.
But I think I'm blessed. I know I'm blessed that I took that. I was given that um, mission. I was
Mission, really. Yeah.
given that duty, and if I was put into this position to take that responsibility, uh, let's figure it out. And we were able to take our patients and see, and we did an assessment, a risk assessment. Who are the most vulnerable? Who are the ones that need us most? Who do we have to focus to make sure that they get proper care? Are they alone? Do they even have family? How sick are they? And based off of that, we engaged with caregivers. We paid them extra out of pocket. We had no idea what's to come, but as my position, I was like, now is not the time for business. This is
Right.
not a business time. This is a time you. It's not a matter of what you're going to be judged at what you do at this time. What you do in a regular circumstances. Oh, he's a good businessman. Okay,
Right.
that I'm blessed. That doesn't do anything for me. It means nothing. But if I can make a difference, and making sure that we were able to accomplish attendance where caregivers went into homes, we had a 93% attendance rate in the height of COVID. That was
What?
absolutely bananas.
Crazy.
One of
Oh
my
my God.
one of
That
my
says a lot about the company and the people working there. I like how
absolute.
you said
This
that.
is not. This
Personal
is
care.
it's the people. And as not, yes, did we give them the right means? Did we do the little stuff to make sure that they went? But these home health aides are rock stars. They are
Yeah.
absolutely. These are queens of the hill. These are people that are. When I see a home health aide, I get up. These are people that did not.
Mm,
These are not people that said, you know what, do I want to become a marine biologist or a caregiver?
right, right. Right. And what's and so let's shift here a little bit to talk about the big beautiful bill and what may be some of the implications of what does the big beautiful bill look like with what's going on now with just Medicaid and Medicare? How is it going to impact? Because we had someone on a couple days ago, and she said that a lot of the resources that are provided through Medicaid, like the expansion that came as a result of the Affordable Health Care Act, aka Obamacare, they are rolling back the expansion portion. So a lot of people who are kids who have intellectual disabilities and challenges are going to be impacted. How do you think that's going to impact your business, your home, the home healthcare aides, if you can't get these resources through, let's say, people, they're not, the state and the Fed aren't really giving them access to the resources anymore? What's going to happen? What's that going to look like for families?
So first and foremost, to say that I understand the big beautiful bill, or I read even
Oh, nobody has. So yeah, I'm just saying, like,
even the people that voted for it, they definitely didn't read it.
They did.
So let's. So I don't want to come across as somebody. Oh, I read that chapter of the bill.
Right.
I just want to make that very, very, very clear. And I think that we both are reading the same. Not even so much in the news, but we're reading the tea leaves, right? You don't have to understand. You don't have to understand the big beautiful bill to understand that
what the impact is going to be.
Exactly.
That's
it goes without saying that it's impacting the system, especially if the barrier of entry has been shut, or even if it's a little bit open, or there's like a little to squeak in. That's an enormous impact. It's going to impact so much, and I think that I believe that long term there's going to be a big price to pay for doing that, because if you're trying, penny foolish, which is if you're not giving them services, you're eventually going to pay for them to go to the hospital.
Well, when we had the conversation, this was a policy person. Kim's a policy person for Medicaid, and she works with one of the nonprofits, the NGOs who assist with Medicaid and the expansion, and they work with federal, the feds and Congress to kind of lobby them to, I would say, do the right thing.
Yeah.
But, she's like, well, what incentive do they have to roll back the expansion and to not continue to the expansion and offering resources? And, I think one of the things that I try to do is get in the head of people, the money people. And if you had to think about it, I think there's a potential to go back to a time where they had institutions. And so moving away from the home care model. But again, remember, these people are business owners. And at the end of the day, if you institutionalize care, cheaper real estate, resources, government contracts, because I come from a government contracting space. So, and then you get rid of the small and the middle business, middle income businesses and small businesses. And you could just corporate, make everything corporate enterprise. Correct. That's what I think.
Yes, I think we're going to see a shift.
Yeah, and that's concerning because I remember what those institutions look like.
Yeah,
because we had one here in my area. Care was poor, families, lawsuits, but I think that's what's coming.
It's very well possible, and I'm sure that the nursing home industry is licking their chops and going, oh, there are good times coming. And there are, and I want to say, I think nursing homes get a bad rap. There are some very kind, good nursing home operators.
Okay.
There, and I'm not saying that for any other reason other than this goes back to my volunteering, where I have a very close friend that I grew up with. He's an administrator in a nursing home, one of the largest nursing homes in Brooklyn, New York. Okay, it's called
Wow.
Borough Park Center. That's a close friend of mine that I hang out with him, and he's an administrator. This man and his team will do anything for a patient, from getting him, besides the care. The man doesn't sleep. I've been watching him for 10 years. That's his life. He sleeps with his phone, from a family needing a fridge in the room to, and I watch this constantly, making sure that the CNA is on the floor and the nurses and the different types of programming to keep them healthy, busy, occupied. And I'm watching him do it. And I've seen it firsthand. And the
Now,
operators
is it private or public?
private.
Yeah.
But usually, sometimes these are the people that are just trying to cut and find the money in the private sector. But there are operators that are genuine gems. So just to put a blanket on industry, even though I'm, as they say, I'm Mr. Home Care, but I think just for a total transparency, yes, there are plenty of neglected nursing homes. It's not. I'm not saying that it's that saying, but they do get a bad rap. A lot of them. There's a lot of hanky panky going on with care in a lot of nursing homes, but there are some good operators. So unfortunately, not always the good ones win, right? Because that's just the way it is. So I think in general, value-based care throughout the healthcare continuum is going to change that. Even in the nursing home setting, if you're not going to prove that you're making a change, you're not getting paid, or you're going to get penalized. If the patient gets readmitted within a certain period of time.
Oh, that's brutal.
So
because then it depends. You really have to have great hiring practices.
Exactly.
To make sure you get the right people who actually care.
Correct.
Yeah, and I know that just from personally running a business, how that can be finding the right people. So is there what's other than, so you have your home care, you don't have state-run care, you just have home care where you can access funds through the state or your own funds, and then you have nursing homes. Is there anything else?
I don't have nursing homes.
No, I'm saying in general, the everyday person. What is other than home care? What is there?
Assisted living facilities.
So how is assisted living
Assisted living facility is not a Medicare. It's not an acute setting for somebody that's just post hospitalization or can't live at home any longer. Assisted living there are assisted living that have that Medicaid pays for, where you get, I guess, somewhat room and board, so to speak. I'm not familiar with that model, so I can't talk too much about it, and I don't want to talk on something that I don't know. But assisted living facilities are another way of life at a certain age. It's usually the elderly. It is for the elderly that assisted living facilities operate in, and they have it's less an acute setting for people that need some assistance in a home, and they get a room with a little living room. There are the private ones. There are the private ones that are super expensive. People have these real ritzy titsy adult living facilities that are on golf courses and all that stuff. So that's the other means of helping elderly age in place, and then assisted living facility is one of them.
And in a nursing home. Okay, so just because I didn't even know the breakout. So you can either say have in-home care, nursing home, assisted living, and then nursing homes.
Yes.
And is hospice and nursing homes the same thing, or that's different?
Hospice that's hospice. Hospice is end of life.
I didn't know that. Okay.
Yeah, hospice is end of life, where there's an assessment made that the person is unfortunately in I guess the tail end of their life, making them comfortable with the reality of what's to come. People that have sadly cancer, or an assessment's made that they need comfort care. So there is lots of hospice, and So there's a lot of these hospice programs that truly help the family, the patient,
Oh, wow.
pain management, social work, helping through the process when things are really not good.
Okay. This has been so educational. I don't think a lot of people kind of know. I know with now they're doing long-term care insurance
Correct.
where people are opting to now prepare. My goal is to live as long as I can a healthy life, but I think that determined to me, and I could be wrong. Anything could happen. Let me do right now, eat right, work out, be healthy, watch what I eat, ensure fighting against not getting diabetes. Because I feel like once you get that diabetes, you can live with it, but
No.
you really got to be on point with your health and just the tracking. Just really doing the right thing. Like, what are some of the preventative things that we can all be doing now? Because you look pretty healthy. I would give you what, 25, Josh?
That's super kind. It was worth the whole show for that. I'm glad that if you did that in the beginning, I think this conversation would be over. I'm blessed to be a father of 7.
What?
My oldest is 26. My oldest granddaughter's birthday was this past week, and she's 4.
Oh my
But yet,
God.
I box and I swim every day, not because of exercise. It's to be able to do what I do. It's more for my brain function, my health, to think clearly, to be able to be in a position to make these innovative changes, build television studios for the elderly that we have, interactive television studios program
What's
that
that?
we do. We have a thing. One of our innovative products that I'm super very proud of is our interactive television studios. We tried to figure out a way, how can we be in a patient's home without a human being being there? How do you be there? How can you be in a home? How can you interact with them? How do you get them engaged? How do you speak to them? How do you educate them on stuff where people don't want to talk about their health? Nobody wants to talk about comorbidities,
That's
problems.
true.
They don't want, like, when I see it with my own parents, and if I'll tell one of my parents, like, you have to start moving around, they'll listen, but somehow, they're gone. They don't want to talk about it. So what we built is the way I try to explain it is we have for our patients at home, we provide them a tablet and a Samsung tablet at home, and we built our own television studios. But what we did is we wanted, instead of like Netflix or one-way streaming, is what we're having right now. What we were able to do is we built a concept where the patients at our home, their cameras are on, and they come on in our studios on the screens. So imagine the game show, Who Wants to Be a Millionaire, Family Feud, right? It's entertaining to watch. But what if you're at home and your camera is on and we see you on the wall and we pick you to answer the question at home?
Wow. So it fosters the community and gives them ways to engage.
Exactly. So we watch this, and this I've put in a lot of money, resources, time, tens of millions of dollars into this, because we were saying, how can we build communities? How can we build friendships? How can we take people that have similar problems, age? So we did this a lot. And the proudest moments that I have from doing this is coming into the studio and watching how everybody's talking to each other. Our host and hostesses engage in programming, and they talk to them, they share with them their problems. I watch where caregivers dress up our patients. They're doing their hair because they're going on television.
Wow, my God.
So we were able to make so many friendships where they never were able to find other people, and that just makes it all worth it. They connect themselves online, and then we have in our continuum what we have for our caregivers, our perks program. I don't know how well aware that what we have, how we retain employees. Our perks program is called You at Perks, where every place we operate, we have buildings that are like a 5-star salon for
What?
our.
Oh my God.
Yes, for
That is absolutely incredible.
yeah. So caregivers, the majority of our caregivers are women. Do you know a
Wow.
woman that doesn't want her nails done or doesn't want her
Okay, her
to,
hair. Yeah.
so we have that for our caregivers for free. It looks like these Delta lounges, and that's where they come. It's for their mental health, and they can decompress, etc. But it comes manicures, pedicures, hair salon services, blowouts, all that stuff. And what we use them for different times is for patients to congregate and come. And the nicest things that I see in our locations at our is when we have those days that we have for patients, and we're like, oh, how do you know each other? Oh, we met online, and we met on your program, and now we go out on walks in the park.
Oh, I love it. So it's
Two
really
different-
getting the seniors a way to move and get engaged,
Yes,
have community, and build
yes,
relationships, because that really is the key
absolutely.
to long happy life. There was a special on that I think on Netflix, how people are living to 100, and one of the main things were, the food, walking, some type of exercise, whether that's being in the garden,
Sure.
walking, having, and then most important was community and relationship.
Absolutely. And the way I like to call it, we don't want our patients to become telehealth potatoes. You
Oh
know,
yeah.
so if you build communities and friendship, get them
Mm.
out, make them go out if they could, if they're
Get them
very sick.
walking.
Yeah, or just go to the outdoors.
Yeah.
Don't just be on your tablet like the little kids in the restaurants with the families that are super slow.
Oh no. I know. It's horrible. It's horrible. Do you
Yeah,
allow your kids to watch? Completely random. Do you have your kids? Do they watch tablets and phones, the younger ones?
I love that you're asking that question because that's absolutely no. And I myself
Really?
I have two phones. I have a smartphone and I have the old-fashioned flip phone, which
No.
only has talk. My smartphone does not enter my home. It stays in my car. It's the same phone number.
Really?
Absolutely.
So no
In
devices at all.
no devices. My wife, God bless her, is the best mom in the world. That I'm the luckiest person alive.
Um,
There are times on Friday she'll let the kids watch something. There are no tablets. My married daughters all don't have smartphones. They have flip phones. I have a daughter that lives overseas. She disengaged from anything of the technology world.
well, I
Has
need
the
to do that.
healthiest, happiest life.
Oh, I
Um,
love it.
I speak to her. No Skype, no nothing. I get to see my grandchildren's on pictures once a week. She goes to kiosk in Jerusalem and sends pictures for the week.
Really?
Yeah, and we have a little
Oh,
electronic digital picture frame, and we get to see the pictures. And I speak to her every single day. The
you
happiest
think
couple.
that every day?
My daughter calls me every day. Uh,
Oh my
so
God.
yeah. So regarding technology, we do we definitely have and we're blessed, and I think it's a communal thing that we do. I'm sorry, a
Yeah.
second my phone. Yeah.
That's awesome. I mean, I think
Yes.
we all need to take a
Yes. Just
page out of that. That might be why he looks so fresh at this age and why his parents are still living. We really have to look at how we're doing stuff in the States.
That's 1 minute. Okay.
It's a lot.
I have a hard stop almost.
Oh no, that's perfect. I mean, I was just about to wrap us up, but this has been great. So no devices. Where do you get a flip phone?
I love the way you asked that.
Like, where do you
Um,
get a
so in the Orthodox Jewish community, there's been
Okay.
a very, very big push in general of trying to suppress technology, information, and bunch of all that stuff
Nonsense. Yeah.
for their reasons. In our community, there are stores that are just for that. They're made just for that. They have offices that you can go in and even have your a smartphone if you need it for business, but they will help you navigate where no apps go on, no Instagram, and they'll set that up. Yes, and it's an extreme. It changed my life.
So
One
you used to have all that stuff.
of course, it's a different ball game. It's a healthier lifestyle. I get to speak to my kids. I'm present.
Yeah, that's what I got. Oh my God, this has been such a blessing, and not just one way. But do I have to go to New York to get the smartphone, the flip phone, or can I? I'm in the DMV area. Just find out where there's an Orthodox Jew.
No, you can get them online, etc. There are plenty of ways. Companies, there is this is not just an Orthodox Jewish community thing. I just want to say it is becoming increasingly popular where people are realizing I'm not talking to anybody anymore. I'm not here. I'm not present. They're just scrolling, getting bombarded with information that is bonkers.
Yeah, I was watching it on a show on Sean Ryan, and he had a guest on there, his new studio. And one of the things he said is teenage girls during COVID had a 40% suicide rate because they were just scrolling, and just the self-esteem is horrible. But this has been confirmation for me. I have a little one, and I definitely need to work on detoxing her from the phone. Yes. So thank you so much.
I personally, because of my experience, that it changed me, and I'm more present. The CEOs that I'm close with, first of all, I think when you walk into a meeting and you flip out a flip phone and you talk like that and you flip it down, it's kind of hot.
It is, because it's like, I'm done with this. I'm focused on you.
I have no time for anything other than an important phone call, and it's not a matter of showing off. It's a muscle move.
Yeah. Oh my God, you're giving me so many good moves, Josh.
Listen.
Thank you so much.
This is a blessing. Your personality just comes through the screen, and it helps me think. It helps me think. I love your questions. I walk away fulfilled, energized. God bless you for bringing up these topics. And if I walk away from this, just changing one thing that was probably popped in my head from our conversation, God bless you, and stay healthy and well, and take care of your little ones. And I look forward to doing this sometime on a different topic again soon.
Yes, I'm gonna look you up when I get to New York.
Absolutely.
See you later. Have a good one. Be blessed.